So my successful journey can be yours. So let me just describe to you my journey and potentially other journeys that are out there. If you're listening to this and you may not want to purchase a practice, well, that's fine. We'll just find a great associateship. You can also go work for a full arch center. They can handle the patients, they can handle the marketing, they can handle the business aspect. And you then just to come in and you can just do the work. I purchased a practice. So I purchased a denture specific practice. And that let me hone my skills after my general practice residency. I got really good at extracting teeth, really good with the alveoplasty, really good with prosthetic surgery. Because I did a denture clinic, I was able to find out if I didn't do a good alveoplasty or a good alveolectomy, because the patients would let me know. They would have sore spots and lumpy, bumpy bone that we'd have to go back into surgery and kind of re-smooth down at no charge. That only happened once or twice, and you learn really good from that. But all on four really needs a good alveo. Doing dentures in a denture clinic allowed me to learn flap design, post-operative patient management, what these patients go through, how to manage pain, how to manage complications, how to manage potential post-operative infection. It allowed me to build my consultation skills, develop a wonderful bedside manner. It let me hone in my IV sedation skills. I got to get a lot of reps in doing sedation, and a lot of reps in doing surgery, and a lot of reps in edentulation. I also got to make a lot of great looking dentures. It helped me then elevate my in-house lab technician in their ability to what they can produce and what they can see. So it was a team-wide approach. Then after we do the dentures, then the next simple step is, now that you have edentulated the patient, now that you've got a nice large flap and you've smoothed out the bone, hey, simply place 2 implants at the time of surgery. So that's what we did. We did lots of mandibular snap-ons. Lots of these snap-ons, we'd then see them at 4 months to uncover. But this allowed me to gain a lot of clinical experience into placing immediate implants. Teeth out, implants in. So if you start there, then guess what? By the time you are ready to jump into all on 4, you've already mastered your flaps. You've already mastered your alveolectomies. You've already mastered your pre-prosthetic surgery. You've already mastered your 2 immediate implants. So all you got to do is add 2 more. All you got to do is angle 1 anterior to the nerve, and you're golden. You're set. That then makes the extra challenge of the extra 2 implants that are angled, and placing the multi-units, and providing a conversion prosthesis. That then makes all of those steps much easier, because you've gotten really good at the rest of it. So it's just small, simple things that we continue to add in. And then the next step, step 4, is go back and do more. Okay? More. The more all-on-4s you do, the faster you become, the better you become, the better you treat your patients, the better clinician you are, the more humble you become, because some things, can present as extra challenges after the fact. And then by you marketing and by you advertising and you taking before and afters and publishing them, then it becomes into this self-fulfilling prophecy. Do more by showing off more. Then the next step, many clinicians may stop there. Many clinicians may stop and hang out and live at step 4. and never move on to step 5, which is really becoming an expert, really becoming, adding advanced implant protocols, adding advanced anchorage, adding zygomatics, adding pterygoids, nasal crests, transsinus, transnasals. Adding those allows you to treat more patients, do more cases, get more reps, and it seems like nowadays all the easy cases are gone. So once you get a lot of reps under your standard all-on-4, then look to taking advanced courses, okay, where you can treat more cases. We would love to see each and every one of you at the Texas Implant Institute, where we teach this, where you get to learn this on cadavers, and we'd love to be a part of your journey and love to be a part of your mentor, because education is the key to clinical growth. You can't go from beginner to intermediate without education. You can't go from over-dentures to all-on-X without education, and you can't become an expert placing zygomatic, pterygoids, transsinus, transnasal, nasal crest without education. And it's not just one course, it's not just one center, it's not just one facility. You need to learn from a lot of different clinicians and gain a lot of different mentors, because you pick up different pearls. Different teaching styles are different. Different people highlight different things that they've seen kind of along their journey. Come spend some time with some heads and Dr. Damon. Our courses are 2 days, 3 parts, didactic, hands-on, and cadaver. And right now we've got 3 different courses. We've got a surgical 1, which is the basic. It's learning. It's going to be like, hey, how do we take out teeth? Hey, we'll teach you in surgical 1. How do we do alveoplasty? How do we do flaps? How do we extract an entire arch of teeth? We will teach you all of that in surgical 1. How do you do implant over-dentures? We will teach you that in surgical 1. Surgical 1 is going to be the best place to start. I get guys that come into the full arch course that they should have taken a surgical 1. This is a new course for us. It's very difficult to go from singles to all-on-4. It is just so nice having this surgical 1 as the basis for your full arch foundation of education. The other cadaver course we have is our all-on-4 flagship, where you get to learn more than you ever wanted to know about all-on-4, and then you get to do it, and I get to critique you, and I get to sit there and I get to show you proper ways to hold the retractor, to do the alveo, to really make you a much better surgeon. And we have our all-on-4 zygomatic and pterygoid and nasal crest. This is more of the advanced concepts, where you're able to figure out, where are we going? Where do these implants go? How do you get these long implants in there? And how do you do all of that? For all the attendees of the course, they can always come by my office. They can get extra training with me. If you live in Texas, you can refer the patient to me. The patient can pay me for the surgery, and you can do it. And then I can also come to your office for teaching. So we really try to have a full circle approach to education for everybody. But guess what? The rest is up to you, my friend. If you want to have a more profitable practice, you want to serve your patients better and have happier patients and evolve professionally, invest in yourself. And if you want to do so, please come and invest in yourself with the Texas Implant Institute. 3 courses to serve you. Check out www.texasimplantinstitute.com. Check me out on Instagram. Check out Texas Implant Institute on Instagram as well. You can kind of stay up to date, hear about our courses and our offerings. And let's crank some arches, folks, and let's do them well. Good night and good luck.